Teal dear, feminists don't understand and really don't seem to like nor particularly respect science. But let us have a look at why, shall we? So, over the past few days, you may have heard about this drug, Addyi, or to give it its correct name, Flibanserin, made by a company called Sprout Pharmaceuticals. And this drug is being hailed as the female Viagra, a claim that I have many issues with, but we'll get to those later. And the existence of this drug and how it came to the market concerns me for a number of reasons. But first, I think it would help us to understand the purpose of this drug, what it's used for, what its effects are, so on and so forth. So first of all, we're going to look at the drugs.com page of it, which is quite a nice sort of layman's introduction, fairly easy to discern. And we'll move on to the FDA page and some of the in-depth study papers surrounding Addyi later, once we've got a good idea of what it is and what its purpose is. So, Addyi, better known as Flibanserin, produced by Sprout Pharmaceuticals, it is designed to treat something called hypoactive sexual desire disorder. It is a multifunctional serotonin agonist-antagonist for the treatment of hypoactive sexual desire disorder in premenopausal women. Hypoactive sexual desire disorder is basically just a lowering of the libido. It basically just means someone who has a particularly low sex drive, and it's usually characterized as someone who has a sex drive that is low enough to the point that it's actually causing them some level of distress or some degree of interpersonal problems with their partner. And Addyi is designed to chemically fix that problem by slightly altering the brain chemistry. And how does it do that? Well, it's quite simple. What it does is it has a direct action on the central nervous system. It corrects an imbalance between dopamine and norepinephrine. Bloody norepinephrine, frickin' American pronunciation there. No, it's noradrenaline. It's only norepinephrine to Americans. But it will correct supposed imbalances between dopamine and norepinephrine, and it decreases levels of serotonin in the body. But what does this actually mean for the body? Well, here is a super quick and dirty breakdown of the reasons why these three chemicals are basically being played around with by this pill. Now, this is by no means an exhaustive or comprehensive look at all of these different neurotransmitters, because if I did that, I would be here for hours. So I'm just going to give you the sort of quick, relevant bits of information about each of them and what this drug does, and why it affects them. So, first of all, dopamine. It basically helps to propagate nerve signals, especially in regards to reward-motivated behavior. Dopamine is normally released when something pleasurable happens, or when you anticipate something pleasurable happening. Dopamine can also be released, however, when someone is particularly scared or in fear of something. So most accurately, dopamine is released at moments of what we would term salience, which is a time when we need or want to pay more attention to something because it's particularly important or very relevant. So by releasing a bit of dopamine in here, or by encouraging more dopamine to be present in the body, what this pill does, it makes someone pay more attention to something and increases their sense of reward to that thing that they are paying attention to. Serotonin. Some people will refer to it as the happy hormone, and the reason that this pill affects serotonin levels is that basically increased serotonin levels tends to make someone feel more satisfied in something that they're doing. It makes them feel happier and more content. So what this pill does is it reduces the levels of serotonin, which basically leaves someone feeling as if they need to be satisfied, which can obviously lead on to theoretically increasing someone's libido, amongst other things. And finally, noradrenaline, or norepinephrine as they call it, because Murica. Noradrenaline is generally used to treat people who have hypotension. Now, hypotension, as opposed to hypertension, hypotension is low blood pressure. So what this will do is to help someone increase their blood pressure very slightly, and this is the only effect that this drug has which is similar to the effects of Viagra. And the reason for this one should be fairly obvious, because it's the same reason that Viagra helps with blood flow. Increased blood pressure means more blood flowing to the genitals, which means better performance. Simple as that. As I said, not exhaustive or particularly in-depth, but this is the reason why this pill affects these three neurochemicals. So, to put it in the absolute smallest nutshell possible, Addyi is basically a mild anti-anxiety, mild antidepressant drug. But there are several caveats to this drug, since it was absolutely plagued with problems during its production. It failed FDA testing 3 times in its production due to having either non-existent effects or an unacceptably high number of unwanted or dangerous side effects. And while I was digging through the history of the development of flibanserin, I found several very interesting things, and the first very interesting thing is actually about the people who own it. Now, flibanserin was not always owned or developed by Sprout Pharmaceuticals. It was originally developed by a company called Boehringer Ingelheim Pharmaceuticals. And Boehringer Ingelheim Pharmaceuticals actually stopped doing any work on flibanserin back in 2010 because they basically saw it as being a bit of a dead end, due to it testing very poorly repeatedly. And it was in 2012 that they transferred the rights of flibanserin onto Sprout Pharmaceuticals. And the thing that I have found really interesting in researching this is that Sprout Pharmaceuticals do not appear to have actually published anything regarding flibanserin since then. They don't seem to have actually authored any particular studies on it, because the only journal-published studies that I have been able to find on flibanserin were all authored under Boehringer Ingelheim Pharmaceuticals. And this instantly is a bit of an alarm bell to me, because I've spent several hours searching through various databases of medical journals, and I have yet to find a single peer-reviewed medical paper submitted from Sprout Pharmaceuticals or anyone who works at Sprout Pharmaceuticals regarding flibanserin. Now, that's not to say that they don't exist, but I just find it so curious that every single hit that I got back was from Boehringer Ingelheim, and some of their findings were really quite alarming. And I'm going to show you this one from the Journal of Sexual Medicine. Unfortunately, I can't actually provide you with a link to this one because this one is not publicly available. You would have to use an academic login in order to get this. So if you're a student at a university, or if you work in a research department at a university or something like that, you should be able to get access to this, but general members of the public won't be able to. But feel free to Google search the Journal of Sexual Medicine. The title of this paper is, as you can see, Open-Label Extension Study of Flibanserin in Women with Hypoactive Sexual Desire Disorder. At least then you can verify that this paper does actually exist and I haven't just made this up out of nowhere. But for anyone who does have the relevant login credentials, there is a Wiley Online link for you to check this out. So how this study was carried out was they basically had a number of women, and they gave them variable doses of flibanserin over the course of a year, between 50 milligrams and 100 milligrams every day. Now, figure 1 here is just quite a nice little flowchart of all of the women who were tested with flibanserin. As you can see, 1,814 were screened, 89 failed the screening, so 1,725 women entered the study. And also, as you can see, 761 women were discontinued from the study for various reasons, leaving only 962 women who actually completed the entirety of the study. But the figure that I find most interesting is figure 3. Now, just so you know what I've missed here, figure 1 is the baseline characteristics of everyone, so it just gives you a rough idea of the kinds of people that were there, and table 2 is the duration of the flibanserin exposure that each one of them had. So you can see I'm not missing out anything crucial here. But table 3 is the summary of adverse events. Now, keep in mind that this summary of adverse events is taken from the 1,725 women who entered the study. And I'm just going to leave that on the screen there for a few seconds, just to let those numbers sink in for those of you who are watching. Out of the 1,723 women who were treated with flibanserin, 1,282 of them reported adverse events. 74.4%. And for the eagle-eyed of you out there, I'm sure you're noticing that one of the major adverse events that people experienced from this, 273 of them, which is just over 15%, is something called somnolence. Now, for those who don't know, somnolence is a very strong urge to sleep. It's a word for something that, puts you in a very drowsy state. And I want you to remember this one because this is quite important later. I'm sure for some of you watching, some of the puzzle pieces are probably dropping into place here, but we'll come to this later. Needless to say, this study kind of highlights that this drug is really not very safe, but this doesn't say anything for how effective flibanserin actually is. There are, for example, treatments out there which can be very effective, but can also have quite severe adverse effects to people who have allergic reactions to them. A really common example would be penicillin. Now, penicillin is an amazing antibiotic, yet about 10% of people are allergic to it and can't have it. But just because some people have bad reactions to it, that doesn't actually necessarily mean that the drug itself is ineffective. The drug could actually be super effective, but even if only, say, 10% of people could take it, that doesn't necessarily mean that we should just instantly throw the drug aside. We can say, okay, it's got a very limited number of people who can take it, but for that limited number of people who can take it, it's amazing. So even though flibanserin does seem to have quite a worryingly high number of negative side effects, if it's a particularly effective drug, then there may still be some merit to having it developed. There is, after all, no shortage of particularly potent drugs available on the market that simply carry on them a warning saying that this will probably make you drowsy, don't drive or operate heavy machinery or do anything while you're on this drug. Certain seizure disorder medications, for example, are a reasonably common example of this. So let's now look at the FDA page. Specifically, the paragraphs dealing with the effectiveness of flibanserin, or Addyi. The effectiveness of the 100mg bedtime dose of Addyi was evaluated in 3 24-week randomized double-blind placebo-controlled trials in about 2,400 premenopausal women with acquired generalized HSDD, hyposexual desire disorder. The average age of the trial participants was 36 years, with an average duration of HSDD of approximately 5 years. In these trials, women counted the number of satisfying sexual events, reported sexual desire over the preceding 4 weeks, and reported distress related to low sexual desire. On average, treatment with Addyi increased the number of satisfying sexual events by 0.5 to 1 additional event per month over placebo, increased the sexual desire score by 0.3 to 0.4 over placebo, and decrease the distress score related to sexual desire by 0.3 to 0.4 over placebo. Additional analyses explored whether the improvements with Addyi were meaningful to patients, taking into account the effects of treatment seen among those patients who reported feeling much improved or very improved overall. Across the 3 trials, about 10% more Addyi-treated patients than placebo-treated patients reported meaningful improvements in satisfying sexual events, sexual desire, or distress. Addyi has not been shown to enhance sexual performance. So, to summarize, people who took Addyi experienced between 0.5 to 1 more satisfying sexual experience, and this is self-reported, by the way, between 0 and 1 more self-reported satisfying sexual experience per month over those who did not take Addyi. I don't think I really have to tell you how effective this drug is. I think that pretty much says it all, doesn't it? Up to 1, not guaranteed 1, the possibility of up to 1 self-reported sexual satisfying experience per month from taking these pills every day. That's laughable, beyond pathetic, borderline useless. So this drug is, first of all, really not very safe, and second of all, it's really not very effective at all. Yet, despite this, several women's rights groups repeatedly petitioned the FDA to approve this drug for no other reason than men have 26 drugs to treat sexual dysfunction and women supposedly have none. which is a claim which is erroneous in itself. There are treatments for female sexual dysfunction available. In stating that there are none, they actually quite intentionally ignore therapeutic approaches. So some of the women's rights groups who pushed this were EvenTheScore, the National Organization for Women, the Society for Women's Health Research, and the International Society for the Study of Women's Sexual Health. And this really irks me because the basis of their push is this discrepancy between the number of drugs available to help men's sexual dysfunction compared to the relative lack of drugs dealing with female sexual dysfunction. And part of the reason that this annoys me so much is that it is a terrible argument to make. And I take this from a page from the BBC. Lobbying by Sprout Pharmaceuticals was backed by the women's rights group EvenTheScore, which has accused the FDA of gender bias by approving a number of drugs treating erectile dysfunction in men without passing an equivalent for women. The basis of their argument is approve this drug, which is dangerous and ineffective, because if you don't, then you are clearly a misogynist. Not only that, but this kind of logic just shows a total rejection of biology. The argument is, okay, you've got 26 things which can treat this condition over here, but nothing that can treat this condition over here. It's ridiculous logic. This is like saying, okay, well, you have this cure for cancer over here, so why don't you have a cure for the common cold? The answer is they are two totally different conditions. And because they are totally different conditions, they require different approaches. For example, most sexual dysfunction in men is generally related to erectile dysfunction. Now, erectile dysfunction isn't so much a psychological problem. It certainly can be, but in some cases it's just a physiological problem to do with blood pressure and heart rate and things like that. So that's relatively easy to fix. That's why men can usually just pop a Viagra, and then when they become sexually aroused, it is considerably easier for them to become fully engorged. Now, that's not discounting male sexual dysfunction, which is considerably more psychological. There certainly is an element to it like that. But erectile dysfunction is far and away the most common, along with premature ejaculation. Women's sexual dysfunction tends to be a lot more psychological than physical. Now, again, this is not to discount women whose sexual dysfunction is entirely physical. There certainly are cases of that. But the majority of them, it is considerably more a psychological condition than it is a physiological one. Which is why female drugs, these so-called female Viagra pills, aim at changing brain chemistry, because that is what is necessary, and that is a considerably more complicated thing to do than simply increasing someone's blood pressure, which is relatively easy from a medical perspective. Also, one only requires a short-term temporary fix, i.e. Viagra, take it as you need it, whereas the other is considerably long-term and is something that may have to be done for weeks, months, or even years. Hence, Addyi would have to be taken every day. But these women's rights groups are absolutely adamant that there is clearly sexism going on, and that it couldn't possibly be anything else. For example, we have the president of the National Organization of Women, Terry O'Neill, who comments, "I fear that it's that cultural attitude that men's sexual health is extremely important, but women's sexual health is not important. That's the cultural attitude that I want to be sure the FDA has not, maybe unconsciously imported into its deliberative process." The pharmaceutical company, of course, also claimed bias, as reported by USA Today. Lobbying by Sprout Pharmaceuticals was backed by the women's rights groups EvenTheScore, which has accused the FDA of gender bias by approving a number of drugs treating erectile dysfunction in men without passing an equivalent for women. So there you go, from the president of the National Organization of Women. Clearly, it's patriarchy. Medical science just clearly prioritizes men over women. It's not that these are totally different conditions treated in totally different ways and that one is significantly easier to treat than the other. No, it's sexism. It's misogyny, obviously. It's the only rational explanation. Fortunately, not everyone has been taken in by the massive amount of pressure groups and the ridiculous marketing campaign that has been going on surrounding Addyi. Cindy Pearson, for example, who is the executive director of the National Women's Health Network, has stated that flibanserin is either ineffective or barely effective. She's also added that she is concerned about fainting and dangerous drops in blood pressure. She says the FDA was swayed by the marketing, not the science. The gender equity argument ignores the real safety difference between flibanserin and drugs approved for men. A different indication for use, specifically the dosage and administration, says a letter sent to the U.S. Senator Barbara Mikulski, D. Maryland, signed by Pearson's organization, and a list of other groups and health professionals. Given the difference between drugs administered daily and those administered on an as-needed basis, it is appropriate for the FDA to subject flibanserin to a higher level of safety scrutiny. No amount of slick marketing can obfuscate the fact that the pharmaceutical industry has yet to produce a female sexual dysfunction drug that actually works. And these individuals are quite right to be concerned about A, the effectiveness, and B, the safety of Addyi, and not only for the reasons that we've already covered. In browsing through some of the FDA's literature, specifically the REMS, which is the Risk Evaluation and Mitigation Strategy, something which all drugs have to be put through to ensure that they don't have conflicting effects with other drugs or other substances that a person might ingest. And flibanserin, or Addyi's interaction with alcohol, is really rather interesting, as is the actual study surrounding it. Page 42 and 43 of the Addyi REMS program prescriber and pharmacy trainer looks at Addyi and alcohol and the increased risk of hypertension and syncope, which is the risk of lower blood pressure and loss of consciousness. Rather curiously, as I'm sure you'll notice from this, dedicated alcohol interaction study with Addyi was performed by 23 men and 2 premenopausal women. 23 men were used to test a drug exclusively for women. What the fuck, FDA? Were you that desperate to push this thing through to prove that you're not a misogynistic organization or some such nonsense that you... Well, clearly you were that desperate. Fucking hell. I have no words for this level of stupidity. But it gets better, because in every instance where you gave people alcohol who were on Addyi, severe hypertension was observed. So basically there was lower blood pressure pretty much across the board. But it gets even better. 4 of the 23 subjects, that's 17% of them who were co-administered 300 milligrams of Addyi and the equivalent of 2 glasses of wine, not only had hypertension, but also had events of syncope. Syncope is the loss of consciousness due to low blood pressure. 17%. So the conclusion from this study was that patients must absolutely not take Addyi unless they can abstain from alcohol for the entire duration of the treatment. Alcohol must not be consumed at all with Addyi. And this is something which I find somewhat amusing, since alcohol can be an aphrodisiac in itself. And I just find this rather amusing. You have to give up drinking entirely, completely abstain from alcohol, in order to experience between 0 to 1 whole extra satisfying sexual experience per month. Give up alcohol entirely for 1 possible better fuck per calendar month. Somehow I can't see women clamoring for that. But this brings up a rather interesting point, especially since this drug was so heavily backed by women's rights groups and feminists. And a point that this brings up is the inevitable issue of rape, a topic that seems to be absolutely inseparable from feminism and women's rights groups. They endorsed something that in up to 25% of cases of taking this is going to lead to impairment of people's motor skills and possible blackouts while supposedly increasing their sex drive. What could possibly go wrong? And then we come to another point, and it's the age-old point about equality and who really wants it. It is unfortunate and indeed a little unfair that women do not have as many options in regards to treating sexual dysfunction as men do when it comes to drugs. and I would certainly love to see some available, as long as they actually work. But now I'd like to take a quick look at another part of people's sexual health and the equality or lack thereof within that topic, and that of course is the topic of contraception. Women's contraceptive options massively outnumber the options that men have. Men's choice in contraception basically comes down to condoms or total abstinence. Or if you are absolutely certain that you either never want to reproduce or never want to reproduce again, you can have a vasectomy. Women's options in regards to contraception are considerably more numerous. Thinking immediately off the top of my head, implants, coils, caps, condoms, spermicides, several different kinds of pill, morning after pill, and then of course there's the advantage of post-conception options, i.e. abortion. In the interests of equality, you would have thought that feminists would support the existence of, say, a male contraceptive pill, or would at least support research into such a thing existing, in order to, say, take some of the reproductive strain off of women. And yet, there are numerous women and feminist organizations out there that actively oppose the existence of the male pill because it would remove power from women and reduce their agency in being able to choose when they have a child. I find it so curious that women's rights organizations and feminist organizations would do such a thing, especially since many of these male birth control pills have considerably higher success rates than this Addyi nonsense. It's almost as if they only care about getting things that will benefit women, even if that benefit is only minimal, or in the case of Flibanserin, only a perceived moral victory that is in no way scientifically supported. But it is what it is. Congratulations, feminism. You have successfully bullied the FDA into putting onto the market a drug that at best is completely useless and at worst is potentially very harmful, all in the name of equality, by using apples and oranges logic and implied accusations of misogyny. And it didn't take you very long to get smug about it, did it? But you know what? Enjoy your small victory. Bask in the fact that you have now given women the option of taking a pill that is going to do absolutely nothing to help their conditions and possibly make it worse, all while wasting their time getting to treatments that will actually be effective because you're jealous of the fact that men have a boner pill. Well played.
Hey, did you guys hear the FDA just approved the first ever medication for women's sexual desire? I mean, this gives a whole new meaning to my 4-hour erection.
I know what to do with it. Why don't you tell me what you're gonna do with that egg beater? Thanks, FDA.